This program has been made possible by a grant from the UCF Office of Research and Commercialization.
The UCF Office of Research and Commercialization is committed to moving the discoveries of our faculty and students from ideas to innovation to realization. By moving research from the laboratory to the private sector, we are helping to diversify Florida's economy and helping to bring high-paying jobs to our state. This program presents some examples of our research and our efforts to transition this research to the private sector.
Welcome once again to another edition of Zenith. I'm Ed Hyland. Our focus here is on research, what is changing our lives, what may change them in the future, and the science that makes it all happen. Today, Zenith covers a wide range of subjects, from the way light is being focused to help fight some forms of cancer, to a golden way to test for mercury in our environment. Details coming up in just 2 minutes.
The University of Central Florida Technology Incubator, cultivating success through creative ideas, performance, and partnerships.
Because there's a lot of people doing a lot of work every day, and that's what everybody brings together. Certainly, it wouldn't be successful without the partnerships.
The Ucf Technology Incubator is a university-driven community partnership providing early-stage technology companies with the enabling tools, training, and infrastructure to create financially stable, high-growth enterprises. With locations in the Central Florida Research Park, adjacent to the UCF campus in East Orlando and in downtown Orlando, the UCF-TI is home to over 50 new and innovative high-tech companies. That's up from 12 companies when the incubator opened its doors in 1999. The incubator has created hundreds of high-paying jobs in Central Florida with an average annual salary of $59,000. Our clients include SiloQuest produces process consumables used in the manufacturing of integrated circuits. The company's technology was developed in partnership with the University of Central Florida Center for Research and Education in Optics and Lasers, otherwise known as Creole. The UCF Technology Incubator, promoting optimal corporate growth and making a significant contribution to the economic development of the region's high technology sector.
One of the most serious and dangerous byproducts of fossil fuels is mercury. This metal, most familiar to us in thermometers, can cause serious illness and death even in small quantities. A UCF researcher has discovered that another metal, a precious one, has the power to detect mercury in water and food.
What we have developed is a Mercury Sensor, actually, that works in gas, phase, liquid, and for solids too. And the way it works is we use very tiny gold particles at the nanoscale. They are about 100 nanometers length and maybe 30 nanometers diameter. And when we put that in contact with mercury metal, what forms is an amalgam. And mercury attacks selectively the tips of the nanorods, actually. And what that does, it changes the effective length of the nanorod, changing its aspect ratio, which is the length divided by the diameter. And these nanoparticles, gold nanoparticles, they present very interesting optical properties that depend strongly on their size. So once you're able to change their size by the presence of mercury, you see a color change, or better to say, a spectral shift. And this spectral shift is just directly correlated to the mercury concentration.
The line you see in the black here is the gold nanorod solution by itself without any mercury, and the red line is the gold nanorod solution where I added that large concentration of mercury to it, and you saw that color change to red.
At the beginning, the suspension of gold nanoparticle looks blue, and depending on the concentration, we see a blue shift, so the suspension becomes more reddish, and eventually, if the concentration achieves certain threshold, the nanorods are actually transformed into nanospheres, and they are pink. So you can actually, depending on the concentration, you can see the presence, or you can determine the presence of mercury by naked eye. Yeah, if we compare this method with existing methods, even the ones with highest sensitivity, these present the highest sensitivity ever reported. We're talking about part per trillions, part per quadrillions. It's very fast. You don't need to do pre-concentration of the solution. You just put a drop of your sample, and you just wait 2, 3, 4 minutes, and then you see the change in color, and you have directly the concentration of mercury present. We're using gold, and gold is very, very expensive. But the thing is that we're using such tiny amounts of gold. We're talking about nanoparticles that if I tell you that perhaps in a test will cost a nickel or maybe less, then you're going to say, well, you're using gold and you're spending just a nickel for a test. So you see, it's very, 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 very cheap. This system doesn't work only as a sensor, but also as a remediation method, because mercury and gold form an amalgam. They stick together. So now we have just one piece with both metal, and you can reuse it because if you boil this, then only mercury will be vaporized. So you need a trap for the mercury that is going to the vapor phase, and you recover pure gold. Now we would like to make a prototype, and we would like to develop the whole remediation system. So we can actually use that in cars, industry, water, just to remove mercury from the environment.
The water testing kit could one day be available for home use. Well, coming up next, could some forms of cancer be treated with light? New insights into research that could change the way we think about chemotherapy. Details coming up. Welcome back to Zenith, and a look at how light, or at least a form of light, is being tested as a possible means of treating cancer. Joining me today is Dr. Kevin Belfield, Department Chair and Professor of Chemistry at the University of Central Florida. Among his many projects, Dr. Belfield is the principal investigator for a relatively new field of cancer treatment called photodynamic therapy. Welcome, Kevin. Thanks so much for coming by and joining us once again.
Well, thank you, Ed.
Photodynamic therapy. I mentioned light and cancer. Fill in the gap here. What's going on with this?
Well, it's very interesting. It's a relatively new modality for cancer therapy. Although it was first used, phototherapy or photodynamic therapy was first used by the Egyptians, ancient Egyptians, where they found that certain constituents in plants could be rubbed on the skin, and they could go out in the sunlight, and they had some success at curing some skin ailments. But then for a couple thousand years, that was forgotten about. And then in the 1970s in the United States, there was some development of materials that can undergo interaction with light and cause reactions in cells. And about 20 years later, that resulted in the FDA approving an agent for photodynamic therapy. And the photodynamic therapy, also called phototherapy or photoradiation therapy, uses typically a very benign substance that interacts very specifically with light and reaches an excited state of that substance, which then interacts with oxygen that just exists in the cell. And then it converts the harmless or the helpful state of oxygen to a very toxic form of oxygen. And that cytotoxic form of oxygen then reacts within the cell, kills the cell, causes the cell death. And then the sensitizer, or the drug that was initially administered, can then be re-excited, can be re-exposed with the light.
I think most people, when you think of light and cancer, the first thing that pops in a lot of folks' minds is a skin cancer. So are we looking at a treatment on the surface of the skin? Are we able to go beneath the surface of the skin? How does that process work?
Typical phototherapy requires that the tumors, the cancer, be on the surface where one can expose it to light. And it is interesting that light has been known to cause skin cancer, and it's also can be used to cure it in some ways. But traditional phototherapy requires that the light be have access to the tumor. So typically some skin cancers, some esophageal cancers, and some lung cancers where one can get light guides or fiber optic light guides down to the surface of where the tumor is, can be treated. Although it's been, it's not a widely used means to treat cancer, but certainly it's gaining in popularity, particularly for skin cancer. But the reason that that light is so harmful to the skin for sunburn is that the skin typically absorbs light. And if it absorbs it, it causes chemical reactions, and it can eventually lead to skin cancer. The way that phototherapy is used to treat it is again by either applying topically or injecting the patient with a substance called a photosensitizer, and that's not harmful to the patient. But where one exposes that to light, it causes this cytotoxic oxygen to be formed, singlet oxygen, and then eventually kills the cancer cells.
Let's kind of start from the beginning in the sense that we've got some graphic support to help explain how all this works. I'm a patient. I come in and I have a skin cancer, something that's obvious that needs to be treated. Can you kind of give us an idea of how the process would work? And also the specific type of light. Obviously, we're not talking about a flashlight here that's just shine, illuminating a tumor. Give us an idea of how the process works, from the patient treatment standpoint.
Sure. The physician would identify where the cancer is, and then either this photosensitizer would be applied topically, or it may be injected intravenously. And then the area only where the tumor is would be then exposed to light. Now, there are two types of photosensitizers that are approved by the FDA. One of them uses blue light, and that's often used to treat the skin cancer. Another one uses red light, so longer wavelength light. One of the limitations is that because the skin is so highly absorbing of the visible light like we have from the sunlight, that the penetration depth of the light is very limited. So that's why phototherapy is typically limited to the treatment of topical cancers.
Now, does the cancer itself, once the oxygen is released and begins to work on the cells, does it die, or is it a chemical like an acid, some other type of reaction that takes place there?
No, the cells die. So there's reaction within the cell that causes cell death, and it's very important to localize the irradiation to only the tumor cells, because it will kill healthy cells as well.
That's what I was going to ask. Are you sensitizing when you begin the process of actually touching the tumor, if you will, or making it more photosensitive? You have to be careful you're just getting the tumor.
Exactly, and that's something that normal chemotherapy is unable to do. In normal chemotherapy, a patient will ingest or be injected with a cancer drug, and that cancer drug is pretty non-discriminate. It kills a lot of cells, a lot of healthy cells. That's why there are such serious side effects. The patient loses their hair and other things, and oftentimes the patient dies of the side effects due to the toxicity of the cancer drug. The phototherapy has a great advantage that the release of the toxic agent, the toxic drug, is localized just where the physician irradiates or exposes the cells with light. The push to go beneath the surface to treat subcutaneous tumors has led to the use of longer wavelength light and the development of other compounds. But one still is limited to a great degree for treating in the conventional phototherapy just the surface type tumors.
Now, is the type of surgery still required after the tumor has been treated? I would assume there would be. I mean, if you eradicate the cells, there's going to be a hole or some depression or something there.
Typically not. Typically the body will repair itself. So the advantages of phototherapy is that it's much less invasive, and so there's no surgery required. There's no risk of infection. The cells will will be monitored, and irradiation can continue until the cells are destroyed and the body repairs itself. The recovery time is typically much faster for patients. And the development of the drugs themselves, although that's been somewhat lagging, could allow for very specific targeting of the tumor cells to make the treatment even more localized.
So you'd be able to put the agent there and it would only go to the tumor, for example, as opposed to healthy cells?
Right. That's the objective, is to make the agent much more selective for the tumor cells. But just the fact that the tumor cells are identified and they can be exposed to light, that greatly localizes the treatment, which one doesn't get in typical chemotherapy.
Chemotherapy generally takes weeks, sometimes months. How long would a phototherapy type of session?
It also could take some time. Certainly not as long as typical chemotherapy treatment. The chemotherapy is limited because of sort of the indiscriminate cell damage that it does, killing healthy cells as well as the tumor cells. So the level of the chemotherapy agent can't be very high, otherwise it could be quite toxic. Whereas in phototherapy, because the drug that's introduced is benign, it doesn't cause any problems, at least ideally, that the treatment is just localized. So it could happen much faster because one could have a higher level of the cytotoxic or the anti-cancer agent released while one exposes with light.
Some malignancies are very aggressive and move very quickly. Can you use this type of therapy with just about any type of a surface tumor, or does it have to be a specific type of a slower growing variety?
Well, there's a lot that's still not known about all of the types of cancers that can be treated by photodynamic therapy. In general, the tumor has to be localized. Things that are moving through the body, for example, leukemia in the blood, that would be more difficult. Would require a different type of exposure. But typically, tumors that are localized are amenable to this type of treatment.
What about, you mentioned other types of tumors and you know, basically research going into perhaps getting into esophageal, I believe is one of the areas you mentioned, some of the more internal type of tumors. We have, again, some graphic support that might show how the light could be delivered to those areas. How does that work?
Well, because of the high absorption of most tissue to light, that the light can't penetrate very deep in the tissue, so it has to be delivered right up to the surface. So one can certainly put hands or skin under the light. One can take endoscopes basically and get into the esophagus, take fiber optics and get into the lungs to treat some lung cancer. But it has its limitations, and at UCF we've pioneered this field called Two-Photon Excitation. And what that uses is long wavelength light that typically is not absorbed by biological tissue, and allows us to go deep beneath the skin, centimeters deep beneath the surface, to reach objects, for example, tumors. And so our contribution to this field is in this applying this new modality of photoexcitation or phototherapy called two-photon photodynamic therapy, which will allow the photodynamic therapy really to be unencumbered by the limitations of only availing itself to treating topical type tumors. We'll be able to treat subcutaneous tumors, and for example, brain cancer is a major challenge for physicians because putting the scalpel in the brain is certainly not desirable, and so the less invasive that can be, the better. And the two-photon photodynamic therapy certainly has a lot of promise in that area.
Does there seem to be a difference in soft tissues versus hard tissue usage of the technique?
I'm not sure enough is known yet about applying this technique for so many different types of tissue. Certainly it relies on having some oxygen present, and certain tumor cells are known not to have a high concentration of oxygen. So it does have some limitations for the type of tumors that would be applicable.
But again, that's going to be part of the research, basically finding out the different areas. You kind of opened a door, if you will, and now you can kind of look at the different venues that you might have to use the treatments.
That's right. Yeah, we've helped pioneer this field of delivering light by two-photon excitation deep in biological tissue, and now we're developing the photosensitizers that can specifically absorb this light and eventually have some specificity to be delivered directly to the tumors themselves.
Now, is this in clinical trials, or have we gone beyond that?
No, this is still in the laboratory.
Okay.
So we're working in the laboratory. Right now, everything is in vitro. We're working with cultured cells, basically in culture dishes. But we have some collaboration with researchers at Florida Hospital that will work with us to transition this into animal studies. And then from there, we'll be looking for a broader program.
And are you working at all? You mentioned before one of the issues is actually the agent that's involved. You've got the light side of it down, if you will. Are you or someone else at UCF working on the agent side of it, trying to see what might be most reactive to the treatment?
Yes, yeah. In my laboratory, there are a number of synthetic chemists, and they're working on synthesizing these agents. We also do the cytotoxicity studies because we don't want the agent itself to be toxic. And so I have a group of chemists that make the compounds, make the new materials. They study the behavior upon exciting with light and study the cytotoxic behavior of the materials.
And then the next question, while you're working on the agents, are you also working on the types of light as well? I mean, you were talking about the blue light and the red light as well, but or have you narrowed it down and said, oh, this is pretty much the types we're going to be involved with?
Well, the one unique aspect about being at UCF is our strong College of Optics and Photonics. And so
I was kind of getting in that direction.
There are a lot of what people may call laser jocks working in the College of Optics and Photonics, and we certainly work with a number of groups, particularly the group of Eric Van Stryland, and then also in chemistry, Eloy Hernandez. They are developing the understanding of two-photon excitation, developing new optical methods of probing it. And with Dr. Eloy Hernandez in the chemistry department, we're looking at actually going beyond the two-photon excitation to three-photon excitation, where we can utilize longer wavelengths, which allow us access to other transmission windows where we can get the light deep into tissue through biological specimens and in tissue. This will open up the treatment even to more highly localized cancer treatment and to deeper type tumor treatment.
Boldly going where hopefully the scalpel won't have to go.
That's correct.
Dr. Kevin Belfield, thank you so much for coming in and sharing this hopefully great news about what's going on in the world of photodynamic therapy.
Great. Well, thank you.
All right. Well, we are seeing the light, if you will, at the end of our time in the form of our Research Minute.
We're going to give you some money. We'll put some money in front of you in a little pot, and you get to put that money right in your pocket. And if you put it in your pocket and leave today, you run the risk that there'll be a big fire and it will burn down your property, and we'll take some of that money back, representing the property loss to you and the damage to your health as well, because there are a lot of health consequences of fires like asthma and heart attacks, which are very, very costly. But if you decide to give us back some of that money, you can buy some insurance by engaging in a prescribed burn. That'll reduce the intensity of a fire if it occurs. It'll reduce the intensity, reduce the probability that the fire will burn your property. And we're going to show that to them in terms of the visual renderings, the effect of the prescribed burn and the effect on diminishing the intensity of the fire. That's why it's important to show that to people. And then we're going to let people make decisions and bear the economic consequences. That's the point.
The goal of research is to better understand the world around us. Our goal is to be a window to that world. Until next time, I'm Ed Highland for Zenith.